Hello there, welcome to my channel. I am your neighborhood pharmacist, and I am here to help you manage your health and take your medications safely. In this video, we will be discussing acetaminophen. Acetaminophen, also known as paracetamol or by brand name Tylenol, is one of the most commonly used and easily accessible pain relievers in the world. Most of us have taken acetaminophen at some point, since it is the first-line medication for pain and fever across all age groups. Because of its availability over the counter, many people assume it's completely risk-free. But when used incorrectly, acetaminophen causes serious health issues like liver damage that could lead to coma and eventually death if not treated immediately. This video will break down how acetaminophen works, how to use it safely, and the most common mistakes people make, so you can protect yourself and your family from accidental overdose. Now let's get into it. Acetaminophen. Acetaminophen, also known as paracetamol or Panadol, is a widely used over-the-counter and prescription medication. It belongs to the class of drugs known as analgesics and antipyretics. It is commonly used to alleviate mild to moderate pain associated with headaches, muscle aches, toothaches, backaches, and menstrual cramps, as well as many other conditions. It can also help reduce fever caused by various illnesses. Acetaminophen works by inhibiting prostaglandin synthesis in the central nervous system, primarily blocking cyclooxygenase, COX-1 and COX-2, which are the enzymes responsible for prostaglandin synthesis. Prostaglandins are hormone-like lipids made by nearly all cells in the body that control various bodily functions, from inflammation, pain, and fever, to blood clotting, blood flow, labor, and menstruation. Prostaglandins are essential for healing. However, they can also cause symptoms like swelling and pain. Acetaminophen is also involved in the modulation of serotonergic pain by enhancing descending pain inhibitors from the brainstem mediated by serotonin, a neurotransmitter. Acetaminophen is used to treat mild to moderate pain caused by headaches, musculoskeletal pain, dental pain, post-operative pain, general body aches from the flu, severe workout pain, and even general aches from exhaustion. It is also used to relieve fever in all age groups, including infants and neonates. Acetaminophen dosing in healthy adults is different from children and other special groups. Adult dosing ranges from 650 to 1,000 milligrams every 4 to 6 hours as needed, and not to exceed 4,000 milligrams in 24 hours or 3,000 milligrams for long-term use. Whereas for children, the doses range from 10 to 15 milligrams per kilogram per dose, administered every 4 to 6 hours, as needed for a maximum of 5 doses a day, or 75 milligrams per kilogram per day. In some cases, dosing can go up to 90 milligrams per kilogram per day. However, it must be a short-term use, like 3 to 5 days, and under supervision. In neonates and special populations with reduced clearance, longer intervals are required. A typical range of 10 to 15 milligrams per kilogram every 6 to 8 hours must be followed. Adults with liver disease, kidney disease, or chronic alcohol use should also have a reduced total daily dose of not more than 2,000 milligrams a day. The most common side effects of acetaminophen include nausea, rash, and headaches, which are usually mild. More serious side effects that are dose-related are acute liver failure, most often due to overdose or unintentional combination use. Elevated AST and ALT, which are biological markers that aid in determining the health of the liver. Stevens-Johnson syndrome, SJS, and toxic epidermal necrolysis, TEN. Rare but possible side effects of acetaminophen. Some drugs and medical conditions interact with acetaminophen, increasing the risk and severity of side effects. Some of these drugs include carbamazepine, phenytoin, rifampicin, isoniazid, warfarin, and cholestyramine. Talk to your doctor or get a free consultation from your pharmacist if you are taking any of these medications before taking acetaminophen. If you are a chronic alcohol user, malnourished or fasting, have a liver disease, or a chronic kidney failure, do not take acetaminophen unless it is prescribed by your doctor. Acetaminophen is available in different forms such as tablets, capsules, liquid suspension, and even as an ingredient in combination medications. Some of the combination medications are Norco or Vicodin, Percocet, Tylenol No. 3, Ultracet, Fioricet, Esgic, Zebutal, Frenulin, Excedrin, Nyquil, Dayquil, Therflu, Alka-Seltzer Plus, Sudafed PE, Coricidin, Dimetap, and Triaminic, just to mention a few. Unintentional overdose commonly occurs due to the use of multiple combinations simultaneously. To take acetaminophen safely, it is essential to always take the minimum effective dose and account for the total daily dose from all sources. While acetaminophen is generally considered safe when used as directed, it is important to follow the recommended dosage and guidelines to avoid potential side effects or liver damage. It is always advisable to consult a healthcare professional or read the package instructions before using acetaminophen, especially if you have any pre-existing medical conditions or are taking other medications. If symptoms persist or worsen, it is essential to seek medical attention promptly. Risk of acetaminophen overdose. Acetaminophen overdose can be dangerous and potentially life-threatening. Taking more than the recommended dose or exceeding the maximum daily limit of acetaminophen can lead to liver damage and other serious health complications. Here are some key points regarding the risks of acetaminophen overdose. 1. Liver damage. The liver metabolizes acetaminophen, but when taken in excessive amounts, it can overwhelm the liver's ability to process the drug. This can result in liver toxicity and potentially lead to acute liver failure, which can be fatal. 2. Symptoms of overdose. In the initial stages, an acetaminophen overdose may not cause noticeable symptoms. However, as the toxicity progresses, symptoms such as nausea, vomiting, abdominal pain, loss of appetite, sweating, and general malaise may occur. In severe cases, it can cause jaundice, yellowing of the skin and eyes, confusion, and even coma. 3. Risk factors. Certain factors can increase the likelihood of acetaminophen overdose. These include taking higher doses than recommended, using multiple acetaminophen-containing products simultaneously, consuming alcohol while taking acetaminophen, and having pre-existing liver conditions, such as hepatitis or cirrhosis. 4. Maximum daily dosage. The maximum recommended daily dose of acetaminophen for adults is generally considered to be 4,000 milligrams mg. However, in some cases, lower limits may be advised, especially for individuals with underlying health conditions or those taking other medications that can interact with acetaminophen. 5. Prompt medical attention. If an acetaminophen overdose is suspected, it is crucial to seek immediate medical attention, even if symptoms are not yet apparent. Quick intervention can potentially prevent or minimize liver damage. Healthcare professionals may administer treatments like activated charcoal or N-acetylcysteine (NAC) to help prevent or reduce liver injury. Acetaminophen overdose stages and timeline of symptom progressions. Stage 1, the 0 to 24 hours after overdose. During the first 24 hours of an acetaminophen overdose, the person might show no symptoms at all, or show non-specific symptoms such as nausea, vomiting, sweating, anorexia, fatigue, and malaise. The dangers and severity of poisoning are not predictable at this stage because the patient might seem better after this stage. Stage 2, from 24 to 72 hours after overdose. During this time, hepatic injury begins. This is characterized by symptoms such as right upper quadrant abdominal pain, nausea and vomiting, and the liver becomes enlarged. Stage 3, from 72 to 96 hours after overdosing. This is the most critical phase, the peak of hepatotoxicity associated with severe nausea and vomiting, abdominal pain, jaundice, yellowing of the skin, confusion or altered mental status, hypoglycemia, and bleeding. Possible complications at this stage include acute liver failure, metabolic acidosis, acute kidney injury, coagulopathy, cerebral edema, and death. Stage 4, from 4 days to 2 weeks after overdosing. This is the final stage, the recovery or death phase. If the patient survives, they begin the process of recovery. They might need a liver transplant if their liver cannot fully regenerate or continue to fail. They might experience multi-organ dysfunction, requiring medical care for the rest of their lives. It is important to note that acetaminophen toxicity is highly treatable with N-acetylcysteine (NAC) if identified early, ideally within 8 hours. However, it is difficult to do so because early symptoms are unreliable and non-specific. Remember, it is important to always follow the recommended dosage and guidelines for acetaminophen and to read the labels of all medications to avoid unintentional overdose. If you have any concerns or questions about acetaminophen or its proper use, consult a healthcare professional for guidance. And do not forget, your neighborhood pharmacist is just down the street. No appointment needed, no consultation fees, and no deductible. You can just walk in, or better still, pick up your phone and make the call. We'll be happy to help. So, when next you pick up a bottle of Tylenol for a headache, or Excedrin for migraine, or any of the combination medications that include Tylenol, make sure you are not taking carbamazepine, phenytoin, or any of the medications that might interact with Tylenol and increase the risk of side effects, or any other medications that might have acetaminophen as an ingredient that might increase the risk of overdose. The information provided in this video is not intended to substitute or replace the guidance from your physician regarding your unique situation. It aims to supplement your knowledge base on Tylenol safety and also highlight the dangers and ease with which an acetaminophen overdose can occur. If you are among the few who made it this far, thank you for watching. I take it that you find value in this video, so please subscribe to this channel, like, and share it with your friends and family to help keep them safe and healthy. Also, do not forget to leave a comment. I'll see you in the next video, where we'll be discussing non-steroid anti-inflammatory drugs, NSAIDs. Until then, stay safe and healthy.